with all of that progress and growth, that I'm sure all of you know how hard it is to build in the social care space. Having a fragmented space of stakeholders, all contributing to the lives of individuals in the communities. With all of that progress, our team asked ourselves, how can we reach people anytime, anywhere, when the need arises? Imagine a new world where a new mom, an older adult, a veteran in need, doesn't need to wait until Monday morning to get the care they need. They don't need to wait until tomorrow 9 a.m. to talk to their community health worker to get connected to a home-delivered meal operation. We are trying to build towards that vision. So moving towards that, I'm so excited today and thrilled to introduce Blooming Health's new social care agent. This is an AI-based, intelligent, compassionate, 24/7 agent that extends a helping hand both to the community members that need the help whenever they do, and to the staff at the social care and healthcare providers that need to care for tens or hundreds of thousands of people every week. This solution can work anywhere, anytime, on any device. This is our effort to bring everything you're hearing about AI movement to people that just have a landline, to people that might just be in need of a meal delivered to them. This matters to us because we strongly believe, social care should not be about physical access, should not be about the language people speak, should not be about where they live. Social care should be available to anyone that needs it, anywhere they need it. This solution will also empower our partners, all the great community health workers, social care workers, the frontline workers that deliver meals, food, transportation, housing services. This will automate a lot of the manual, mundane tasks you need to do. This doesn't replace human touch, because we all know that people in the most vulnerable moments of their lives need that human touch. But it can extend and augment your ability to screen more people and detect needs faster, to find them a resource that can address their need faster, to follow up with them, to make sure when we talk about closed-loop referrals, it's not about a piece of paperwork being handed over to another staff. It's about someone that is food insecure actually getting their need addressed. So putting the member in the center while augmenting and extending the staff's ability to be able to provide care. This is all about scaling care without scaling the cost. This is why this platform and the work we're doing here matters. But rather than just talk about it, let me actually show you how it works. We're going to do a quick live demo here. Fingers crossed the demons of live demo will not catch us here. So the context here is that the agent is going to call me. It's going to talk to me about food insecurity, try to figure out if I have a need. Based on my responses, it's going to find a resource for me that can deliver a meal to me, sign me up in a SNAP, get me connected to a local food pantry, and it's going to then follow up with me in a few days to make sure I actually got that care. So this is not about just pushing the paperwork to the next entity, but about my need to be addressed. We're going to give this a shot quickly here. So what's going to happen is that I'm going to get a phone call on my cell phone. Let me actually grab the handheld mic. I'll need it to be able to play the sound for you here. Right, I got a call from Golden Care. Hello.
Hi, Nima. We're Golden Care Community Services, checking in about any food access issues you might have. We can connect you with free food programs. We may share your responses with your care team or local partners. Is that okay?
Who is Golden Care?
Golden Care Community Services is a nonprofit organization dedicated to supporting seniors, low-income individuals, and non-English speaking communities by providing essential social services, health resources, and community-based support.
That's great.
Let's go back to our question. Do you consent to share your information with our care team or local partners who can help?
Yes.
In the past 12 months, did you worry that your food would run out before you had money to buy more?
What do you mean food running out?
That means if you've ever been worried your food wouldn't last until you had money to buy more, or if you ran out and couldn't afford more.
Understood.
Let's go back to our question. In the past 12 months, did you worry that your food would run out before you had money to buy more? Often true, or sometimes true, or never true?
Often true.
Did the food you bought ever run out before you could afford more?
Yes.
We're sorry you're experiencing food insecurity. We want to connect you with a trusted organization. Which support option do you prefer? SNAP grocery benefits, free food pantry nearby, or home-delivered meals?
I'll prefer a home-delivered meal.
Nima, do you consent to share your information with God's Love We Deliver for home-delivered meals?
Yes, I do.
Thank you, Nima. Based on your answers and location, we're sending your referral for home-delivered meals to God's Love We Deliver. You'll get the referral details shortly. We'll also check in after 2 days to see if they've reached out. If you need help before then, feel free to call us back. Have a wonderful day.
Pretty amazing, right? That's what dignified care at scale is going to look like. This was in English because I can only speak Persian besides English, but I could as well speak Chinese here. I could speak Spanish, and I'll get the same level of help I need. This is actually what just happened. A referral was generated. I know our folks from God's Love We Deliver are here. You're not getting a piece of work from me here, but the referral was just sent. They got notified. They now know I need help. And my information was shared with them because I gave the consent. By the way, this could be done for 1 million people in a few hours. You don't need a large 2,000, 5,000 care management team to do this. You can do this literally with 5 people, just monitoring what's happening for these people at scale.